dental radiology, and infection control.
Let's delve into critical practices that ensure both patient safety and diagnostic accuracy in dentistry.
Radiology equipment plays a critical role in dental diagnosis and treatment planning. To ensure infection control in the dental clinic, it is important to implement proper disinfection and maintenance protocols for radiology equipment. These measurements help prevent cross-contamination and maintain the functionality of accuracy and equipment. These are the following guidelines.
Number 1. Disinfection of radiology equipment. Proper disinfection of radiology equipment helps minimize the risk of microbial transmission. Consider the following practices.
Clean and disinfect the exterior surface of X-ray units regularly using appropriate disinfectant wipes or solutions. Pay attention to areas that are frequently touched, such as control, buttons, handles, and support structures.
Image receptor disinfection. If using digital image receptor, follow the manufacturer instructions of disinfection. Use approved disinfectants that do not damage the receptors. The film-based radiography ensure the proper handling and storage to avoid contamination.
Use disposable barriers, example, plastics, wraps, or bags, to cover X-ray unit to control panels, K-pads, and other surfaces that are prone to contamination. Change the barriers between patients or as needed.
Number 2. Maintenance of radiology equipment. Equipment calibration. Follow the manufacturer's guidelines for regular calibration of radiology equipment. Calibrations ensure accurate and consistent imaging results. Also, establish a maintenance schedule and contract with authorized service providers to address any equipment repairs or technical issues. Promptly address any malfunctions or abnormalities in X-ray equipment. Number 3. Operator training and hygiene. Proper operator training and hygiene are essential for infection control and using radiology equipment. Consider the following measures. Operator education. Provide comprehensive training to operators on proper disinfection protocols, equipment operation, and radiation safety practices. Ensure operators are familiar with the manufacturer's instructions for disinfection and maintenance.
Also, hand hygiene. Emphasize the importance of hand hygiene for operators before and after using radiology equipment, and encourage them to have a thorough hand washing with soap and water or the use of alcohol-based hand sanitizer. The next one, PPE or personal protective equipment. Ensure operators wear appropriate PPE such as disposable gloves, protective aprons when handling radiology equipment. PPE should be changed between patients or when necessary. And the last one is radiological safety. Train operators on radiation safety procedures, including proper positioning of patients, use of lead aprons, and adherence to regulatory guidelines for radiation protection. Proper handling and storage of radiographic films and digital images are essential to maintain their quality, integrity, and to ensure infection control in dental clinic. Implementing appropriate practices for handling and storage help prevents damage, contamination, loss of important diagnostic information, and these are the following guidelines. Number 1. Handling of radiographic films. When handling radiographic films, follow these practices to maintain their integrity and prevent contamination. Of course, again, hand hygiene. Perform proper hand hygiene by washing of hands in soap and water and using alcohol-based hand sanitizers before handling the radiographic films, because this helps prevent the transfer of microorganisms and contaminants. The next one is gloves. Of course, we wear clean gloves, disposable gloves, when handling radiographic films to minimize direct contact with the film surface. Also, we must maintain clean surface. Ensure the surface where the films are placed or processed is clean and free from contaminations. Avoid contact with chemicals, liquids, and other substances that may damage or contaminate the film. The next one is avoid bending or folding. Handle radiographic films with care to prevent bending and folding or creasing. This can lead to artifacts or irreversible damage that may affect the diagnostic quality of the images. And of course, for the last one, film identification. Clearly label each radiographic film with patient identification information, date, tooth number, or area to ensure proper organization and avoid mix-ups. Disinfection and sterilization of film holders. Of course, not only we have a proper sterilization for the films, but also to where it is placed. So film holders are reusable devices used to position and stabilize radiographic films during exposure. To ensure infection control, you must follow these practices for disinfection and sterilizations. Number 1, reusable film holders. Clean and disinfect reusable film holders after each use, and follow manufacturer's instruction and protocols for proper cleaning, disinfection, or sterilization methods. Also, compatibility with disinfectants. Ensure that the chosen disinfectant is compatible with the material of the film holder to prevent damage or degradation. Follow manufacturer's recommendations for disinfectant contact time. And also for the last one, sterilization for high-risk cases. In cases where contamination is likely due to the patient's infectious status or treatment needs, consider using disposable film holders or sterilizing reusable ones using appropriate sterilization methods. And for the next one, it's also important for the storage of radiographic films and digital images. For the proper storage of these films, it is crucial in maintaining their quality and protecting patients' information. So number one, secure a storage area. Store the radiographic films and digital images in a secure, restricted access area to protect patient privacy and prevent unauthorized handling or viewing. The next one, protection from environmental factors. We must store radiographic films in a cool, dry, and dust-free environment to prevent degradation and protect them to excessive heat, humidity, and exposure to light. Also, the organization and labeling of these films is important. Maintaining systematic organization of radiographic films and digital images using appropriate labeling and filling systems. This facilitates easy retrieval, minimizes the risk of misplacement, and supports efficient workflow. And for the last one, of course, backup digital images. We must create a regular backup of these digital images to ensure data integrity and prevent loss due to technical failures or data corruption. And we must implement appropriate data storage and backup strategies such as secure servers or cloud-based solutions.
In conclusion, dental radiology plays a crucial role in diagnosis and treatment planning, providing valuable insights into oral conditions. However, it's imperative to recognize the significance of infection control measures in every aspect of dental radiography. By strictly adhering to established protocols, including proper sterilization of equipment, utilization of protective barriers, and maintaining clean environment, we ensure the safety of both patients and dental healthcare providers. Together, with a commitment to excellence in both radiographic imaging and infection control, we can uphold the highest standards of care and promote optimal oral health outcomes for all. I hope this discussion on dental radiology and infection control has been enlightening and informative. By understanding the importance of meticulous infection control practices alongside the critical role of dental radiography, we contribute to safer and more effective dental care delivery. So let's continue to prioritize learning and implementing best practices to ensure the well-being of our patients and dental professions alike.
X-ray unit disinfection. Clean and disinfect the exterior surface of the X-ray units regularly.
2, 3, go.
X-ray unit disinfection. Clean and disinfect the exterior surface of X-ray units regularly using appropriate disinfection wipes or solutions.